Hi everyone, welcome back to iMumz Women's Day Week. Today we have two very special people again to talk on a different topic, and I'm sure you guys had a lot to learn from yesterday's session, and you will have a lot to learn from today's session. So without any delay, I'll quickly introduce our guests for today. Our speaker is Dr. Kavitha Gautham. She's the lead gynecologist and director of Bloom Fertility and Healthcare Center, and also the director of Bloom Birthing Center. So she basically specializes in natural delivery, hydrotherapy, and vaginal delivery after C-section. So we are very happy to have you with us, Dr. Kavitha.
Thank you.
And moving on to our guest for the evening, we have Sai Pramodita. She's a state champion and national level bronze medalist in gymnastics and diving. She has participated in two dance shows and also acted in a lead role in a Tamil serial called Kanam Kalangal.
Kanam Kalangal. Yeah.
Okay, sorry.
Very difficult.
Yeah, after a successful career, right now she's focusing on her two little boys, one 6 years old, one just 3 months old. So she had a vaginal delivery after her C-section. So we are looking forward to this conversation, and our users are very excited to have you both here. Over to you, Sai.
Yeah. So, as you said, my VBAC experience was with Mrs. Kavitha Gautham. It was quite a life-changing experience for me. After a C-section, I never expected that I'll have a normal delivery. So that was really great. But I have a lot of questions to ask you, Doctor, in this topic. So I think it will be useful for all the women as well. So a very happy Women's Day, and thanks for iMumz app for celebrating the Women's Week. Maybe we'll start with the questions, Doctor.
Yeah. Okay, sure. Go ahead.
Yeah. So my first question is, why are we having a lot of C-sections right now? Having a normal delivery is like miracle, people are like, wow, normal delivery. So that's the kind of scenario right now. Why do you think it is it because of the lifestyle that we have, or is it because the hospitals are really becoming commercial just to I don't want to say the word, but yeah, it's become really commercial, Doctor. What is the reason?
I think this is very important question because many people have this thing in their mind, and many of the movies are talking about the increasing in C-section rate, and it is because of commercialization of medical profession. But I would like to talk and answer about this. Let me share my screen.
Okay.
So, but I'm going to talk about the entire conversation is about the birth choices and birth planning. So, your initial question and the first question I'm answering. So, in India, the traditional birthing practices were like this. The images, if you can see, all these are sculptures from our temples. So, the any delivery was like filled with joy, and they was like surrounded by their friends and family, and the woman is not in one particular position. She's not in a lithotomy position as we see nowadays. She's seen as squatting, she's seen as reclining, she's seen on the lap of the family member. So it is like a comfortable thing, a joyful and memorable thing. This is what is being depicted in our history. So this kind of a joyful situation, a memorable situation in any woman's life is the birthing experience. So why we lost this? Why are we doing all the deliveries nowadays in the hospital? Is something which I'm going to answer, and that answer would be the answer for your question as well. So it all started after our independence. That the United Nations gave us a target for most of the developing country as one of the development marker as the maternal mortality rate. So every country, they gave a target of reducing the mortality rate to 107 per a lakh deliveries. So this was a target given to India as well. So if India has to show that it is a developing country or a developed country, it has to reduce the maternal mortality rate. So what India did after the independence is there was a system of dyes. So initially the deliveries were conducted by the dyes in each village. Dyes are the traditional birth practitioners who were available in each village. So they are the people who will go and conduct deliveries. And the difficulties which was happening those times was a lot of women were dying. Though it was like very memorable, they were surrounded by friends, they were surrounded by the family, there were a lot of rejoice which was happening. Each one was singing and each one was like telling their birth stories to motivate the women to deliver. All these were happening, but at the same time, there were a lot of women dying due to some kind of complications. And our maternal mortality rate was somewhere like more than 700 births which were happening. So the first thing which India had to do was to they decided to abolish this dye system. The traditional birth practitioners, they initially started training them, but then later what they did is slowly abolished all the home deliveries just to give more medical comfort to the woman who's birthing. So even our Taj Mahal was built because Mumtaz died during the delivery, and that is why the Taj Mahal was built by Shah Jahan. So that's a very known one of the maternal mortality in India. So much of rejoice, but then there was a lot of difficulties were also being faced because of home birthing. So India decided to bring all the women to hospitalized birthing. So they even incentivized the panchayat heads in each village to bring the women for delivery inside the hospital. But slowly, what they did, even nurses were not trained for midwifery. So, though even the nurses were not given adequate training in midwifery, the dye system was abolished. So, everything came to the doctors. So, every institution had very limited number of doctors, but there were a lot of women who were brought to for hospitalized deliveries. So doctors were seen rushed, very impatient, fatigued because the volume was more and the number of doctors were very less. And what was expected out of these doctors? They had to be a doctor, they had to be a nurse, they had to be a birth supporter, they had to be a counselor, and their availability was needed 24/7 to give this women safe delivery. So the comfort was forgotten and safe delivery was more focused. This happened after the 1970s or 1980s, and every birth was done only in hospital by the doctor, and this became a dictum. So the number of C-section rates, as you said, in India is very high. And these are few points which came to my mind. That is, no proper nutrition and physical activity was reduced. Nowadays, when women gets pregnant, there's like balanced diet is not being advised. They immediately the family tries to give them a lot of nutrition which is not required, and eventually they gain a lot of weight during pregnancy, and their activity is also reduced. So whenever there is a woman pregnant in our family, we tend to say, don't do any work, please eat well and take rest. So this is something which is affecting them and getting them into other medical complications because of a lot of weight gain. Like they get into diabetes during pregnancy, they get into hypertension during pregnancy, and that is leading to a lot of C-section. So no proper education about childbirth to the common public. So nowadays we're not talking about the childbirth at all. The girl till the marriage or till the delivery is not given a proper education about what her body is undergoing, whether it's a normal change or something which is abnormal. Even that advice is not given, and it creates a lot of fear inside the girl. And maybe that fear is not giving a positive result. And superstitious belief, especially in India, we have this among the Hindus, we have this superstitious belief that our baby has to be delivered in a particular auspicious time. So this is something which is forcing people to come and ask us. Every time the family comes and asks us, doctor, I need this baby to be delivered at this particular date, at this particular time. There are people even who ask the seconds to be in the minutes and seconds to be very specified. So those kind of superstitious belief should not be there. That's not a doctor's problem, but that is a society's problem. And decreased pain perception. Nowadays, each family is a nuclear family, and each family has a daughter or a son. So the daughter is very precious to the family, and they feel, if the daughter is brought up in a very delicate manner, that even a smallest needle prick is something which is very painful for that girl, and they think the labor pain is something which is beyond acceptance. And need for better obstetric training for doctors. As I told you, obstetrics is something which is to be supported with a lot of support system, like midwives need to be there, properly trained nurses should be there, and a counseling team, probably a physiotherapy team which can explain the exercises and all that is needed. But everything comes to a doctor, and doctors are not adequately trained in just doing a delivery process. We are also trained in laparoscopy, we are also trained in IVF, we are also trained in multiple other surgeries where the obstetric training is just a part of it. So we are not just focusing only on birthing and delivery. So it's a part of our training. And decreased trained birth attendance. As I told you, we don't have adequate team to support a birthing. So these are all the few things which has put a raise in the C-section rates. And also that we need to give a proper safe maternal, the safety of mother and baby is something which we are focusing on rather than the comfort, and maybe that also can be one of the reasons where the C-section deliveries are high. So the C-section rate as a whole in India, this is recent publication which is showing that C-section rates are very high in South India compared to northern part of India. So eventually, this is a data in 1990 where our maternal mortality rate has come down very much drastically from 2010 to 2014. It is a decline, but at the same time, there's a lot of C-section which is happening because of the declining maternal mortality and increased care provided for this women. Maybe we are doing a lot of C-sections. So what is in need now? The World Health Organization is saying the birth of a child is a pivotal time in the life of a mother and her family. The health and well-being of a mother and child at birth largely determines the future health and wellness of the entire family. The outcome of a childbirth, however, is not only a factor of importance to the mother's well-being, it is also saying that it gives a lot of importance to the child's psychological development as well. Some researchers suggest that the way in which a woman experiences pregnancy and childbirth is also vitally important for mother's relationship with the child and a future childbearing experiences. So this is not something which I say, it has been all researched and it has been published in research articles also in the World Health Organization. So giving comfort as well as giving a memorable and comfortable birthing experience to mother is very important. So there is a need for change in our medical practice or the birthing practices. First, in birthing environment, there are which are very stressful or potentially disempowering for a woman. Like if you see a government hospital, you can immediately imagine a busy maternity ward with no private rooms. There's not even a curtain between the women. And women may be more likely to experience the institutional routines. It's like, it is the same thing done for all women. There's no prioritization or individualization given to each woman. And these conditions may have a high negative impact on her feelings of confidence and control. So this is something which is scaring this woman, the way the maternity ward is. So this fear and anxiety also initiates a hormone called the epinephrine in the blood, which is leading to a lot of fetal heart rate problems, increased uterine contractility, a longer active labor phase. So these are all certain things which can put the fear and anxiety alone can cause, get them into abnormal fetal heart rate and then leading into C-sections. And there is also a lot of increased postpartum depressions. That is more than 10 million cases per year in India facing the postpartum depression. And 20% of mothers in developing countries have postpartum depression. So the commonest factor for all this, we see one of the commonest factor is their birth experience, dissociation, lack of support during birth, and operative birth. All these are some of the risk factors which can put these women into postpartum depression and post-traumatic disorder. So continuous emotional and support and information and advice towards the birthing process and delivery is definitely needed to control, keep them calm and reduce their anxiety and fear. And the World Health Organization believes that no more than 10 to 15% of babies in a country should be delivered via C-section. So I think now we have to focus on to this and reduce our C-section rate. So far we were looking into reducing the maternal mortality. Now I think we have to look into reducing the C-section delivery rates. So we need a support system and a change in the way we think. We are in need to create a better world, and we need to create a better, wiser future generation by reducing the number of C-sections. So Sai, I think it is now nowhere related to commercialization. So this is something which is putting a lot of stress into the doctors, where we are overworked. Sometimes maybe we have to give 24/7 care sometimes, which is not possible, and we have to decide earlier.
Okay, doctor. I think, yeah, I've got a better picture now rather than just assuming what the reason is. So, can I go to the next question, doctor?
Yes.
So, what is natural birth, doctor? For me, just having a baby itself is natural. So, what is different from a vaginal birth and natural birth? A normal delivery and natural birth. What is the difference, doctor?
Yes, everybody gets confused with a normal delivery or normal vaginal birth and natural birth. There's a little bit of difference between these two. So natural birth is always a team-based approach. It needs an obstetrician, maternity trained nurse, or a midwife, a doula, or birth partner, a physiotherapist, counselor, and lactation consultant. This is a team-based approach. And natural birth is a birth which happens without any medical intervention. There's no medicines given at all. There's no medicine given to induce the labor or increase the contractions or pain, or give any pain medications. So there is absolutely no medical intervention in a natural birth. So natural childbirth arose in opposition to techno-medical model of childbirth that has recently gained popularization in industrialized societies. So this is something which is against what is happening now. And natural childbirth attempts to minimize the medical intervention. There is no anesthesia, and there is no episiotomy. There is no instruments used. There is or a C-section done, and there is no medication for pain relief, for induction or augmentation of the labor as well. Why this natural birthing started? When did it start? It all during the Industrial Revolution in America, where there was a lack of facility and congested living space. Women were pushed into hospital deliveries. So initially, when there was feministic movement, the first thing which the female wanted was a birth without pain. So that was the start of the early feminist movement in America. And the start of modernization, the use of childbirth drugs began in 1847 when Scottish obstetrician James Young Simpson introduced the chloroform as an anesthetic during labor. But only the most rich and powerful women like Queen Victoria had the access. So general public or the normal women were not given this option at all. Only the high and affluent women were given this option of pain relief during labor. So the term natural birth was coined by an obstetrician, Grant Dick Reed, way back, and it was also supported by Dr. Lames and Dr. Bradley. So these two American gynecologists, they started promoting this natural birth. Lames created an American Society for Psychoprophylaxis in Obstetrics, and Bradley introduced a husband-coached childbirth, where he included the husbands for supporting these women in childbirth. So many women consider natural birth empowering and gives women more control in birth process, pushing against the paternalistic medical establishments. So what are the techniques which are used for pain relief in natural birthing is hydrotherapy, massages, relaxation therapy, hypnosis, breathing exercises, acupuncture for labor, and transcutaneous electrical nerve stimulations, vocalization, visualization, mindfulness, and water birth. So these are all something which are not medicine, but these are all something which are still available and can be used for pain relief and comfortable birthing. So labor is physically and emotionally demanding. Women need to be praised, encouraged, and reassured that things are going well and that they are doing well, and what is necessary for the safety of the birth of the baby. So this kind of encouragement and support is very much needed for a comfortable natural birthing, which is all done as a team-based approach.
Wow, doctor. Lot of information. Yes, doctor. So now we're talking about natural and normal delivery. Now we are already talking about two kinds of birthing. So I see that in abroad, a lot of my friends say they sit in a water tub to give birth. Like I don't know, and they give birth inside the water, and there are other options like they deliver in the house. So, what are the choices we have over here, doctor? And do we really have a choice in? Can we choose how we are going to deliver the baby?
Okay, if we look into choices of birthing, we have a lot of choices. I think most of the women are not even aware of. That is, one is vaginal birthing, natural birth, as I spoke about little before, and even the C-section is given as an option. It could be a scheduled C-section, an unplanned C-section, vaginal birth after C-section, a scheduled induced birthing, a water birth, and hypnobirth. These are all certain choices which are available and which are given. And whether if I have to answer this question, whether it's available in all hospitals or all, is it offered by all the doctors all over India? I don't think it is being offered. So still the decision of birthing or the way a woman has to birth is something which is still in the control of doctors. It is not given as a choice to the women, and slowly this concept of giving choices and making a confirmed conscious decision between the doctor and patient is something which is evolving now, and certain centers, certain doctors in India have started practicing this. And as you asked, like birthing inside the tub is still happening in India. It can happen, and using hydrotherapy for pain relief is still happening in India. And home birthing is something which our government is against, and our government is not really supporting a home birthing. We would like to do a safe, comfortable, memorable, hospitalized home kind of birthing rather than a complete home birthing. I don't think government is still supporting a home birthing, unlike in other countries.
Other countries, yes. So, how about having a plan, birth plan, doctor? Can we really do it? Can we plan it from the beginning?
Yes. Coming to birth plan, I would like everybody to understand what is a birth plan. Birth plan is nothing but every woman has some kind of imagination, some kind of wishes towards what she wants to do, how she wants to birth, and whom she wants to be with, and how she has to be treated during the labor process. So this is a birth plan. Sometimes what happens, another reason where doctors are blamed in India for many decisions during the treatment process is because the conversation between the patient and the doctor doesn't happen so much. So most of the time the decision is made by the doctor and it is just implemented. So this is something, it is a two-way conversation which happens between the patient. She tells that I am expecting all this to happen, and the doctor understands this and provides that care if it is an acceptable thing. If the patient wishes something which is not acceptable, it is in prior explained to the patient that certain things we will not be able to do, or certain things are not good for the mother and baby, and it is clearly understood before we even get into the process of delivery. So what is a birth plan? It is a protocol agreed between the mother, midwives, and doctors, listing options such as birth companion, who should be with me, and position of birthing, how I need to be during the delivery process, whether I have to be in a squatting position or whether I have to be on my back, that is lithotomy position, or whatever, and whether I need a pain relief, etc. Has been, all these are being discussed in agreement before itself. So it's a clear-cut two-way communication between the patient and the care provider. So do we need a birth plan? Yes, this is something of discussion. So in India, we have so many women coming for delivery, and every year we are the highest, second largest country in population. So many births are happening. So whether do we need this? So we must recognize the value of reiterating the importance of considering women's wishes, knowledge, and feeling of their birth experience. So now is the time that we have to give. So far we were like giving importance to the safety of mother and baby. I think now it's a time that we give importance to the women's wishes, feelings, and experience. And maybe if we have to give them a good experience, we need to discuss about what she needs. So does India need it? With our well-indulged focus on developed country practices, we ignore the concerns and issues of importance to most women in the world who live in the developing countries. So we are not giving importance to women in developing countries. So I think this is the time where even if India is still a developing country, we need to give importance to this. Otherwise, we will sadly neglect our ethical and moral obligations to human rights. It could be a human right violation also. It can be taken that way. So even C-section, there's an accusation against doctors for doing unwanted C-section. So if we have had this prior discussion, what the patient needs, and if the doctor has explained everything to the patient in detail, probably this accusation against doctors might not even happen. So these, I don't want to get into the details of how to, what kind of birth plan and all. I think it is better a discussion birth plan is something which has been implemented everywhere.
Yeah, doctor. Now, where exactly is a birth plan promoted, and who accepts it, doctor?
Currently, very few doctors in India are accepting a birth plan and are willing to talk to patients about the choices, what they need, and what kind of experience they would like to go through. Very few doctors in India are accepting it, but it is a routine and it has become a part of their routine in many other countries. Most of the developed countries are doing this, but developing countries like India are still finding it difficult to accept it. Probably slowly it might happen.
Okay. So then, I would like to ask if is it really necessary to have a birth plan from the beginning? What if we are really not aware of it?
What to be I'm not getting the question. I think it is what to be included in a birth plan.
Do we? It's like why do we need a birth plan at all?
Okay. Birth plan is always to give an unique experience to the woman. Creating a birth plan empowers the woman to be completely informed of everything what is going to happen to her during the birthing process. So she's well aware of what is going to happen, and it's a good communication between the care providers and the patient, so that there's no fear or anxiety which has been created between the two. So this, by having a birth plan, definitely the women will have a very comfortable and delivery without any fear and anxiety. I think that is something which we need to give them.
So what exactly should be included in a birth plan, doctor?
So if woman has to write her birth plan, there are certain things which she has to know before even thinking of a birth plan. It's not just I need this particular doctor to deliver, or I need this room to be delivered. It's not like that. There are certain things which you have to go through. So where do you want, whether you want to deliver inside a delivery room or whether you want to have a delivery inside a normal, a comfortable room. Do you want to offer medication, whether you need a pain relief, whether you don't need a pain relief? Do you want a natural birth, or you want to use any other alternative kind of birthing, like water birthing or hypnobirthing, any other option? Do you want to freely move around? These are few questions which normally is being framed in a birth plan. So most commonly, we talk about the atmosphere. Would you like to have a dim lights? There are patients who like it to be very calm, with dim light, with light music, and not too much of noise around. So when they are in pain and they're in a kind of uncomfortable situation, I think they like the surroundings and atmosphere to be very calm and silent and serene. So this is most of the time, this is what the women will ask for. And labor preferences. Yes.
Yes, sir. No,
Yes.
please continue, Dom.
Okay. So in labor preferences, there are certain common things which we will come into an understanding. That is, whether the woman wants to freely walk around, whether she wants to continue doing her exercises. Many of women will keep doing the lunges, the walking, the birth ball exercises. So whether it depends on the woman. And do you want to use birth stool, how she wants to deliver, and would you like to take a warm shower or bath, whether she wants a hydrotherapy for the pain relief, or these some labor related questions which can be discussed prior. And pain medications, we have so many options for pain medications as such, that is the nitrous oxide inhalation, the epidural anesthesia, hydrotherapy for pain, and hypnotherapy for pain relief, birthing exercises and massages. So I think it is better we have a discussion and choose which that particular woman wants to go through. And in delivery preferences, if you are planning for a vaginal birth, would you prefer not to have an episiotomy? Very important thing is whether they want an episiotomy or they don't want an episiotomy, whether they want a partner to be with them. Sometimes they ask for the partner to cut the umbilical cord. This is something which is followed in abroad countries, and many would like to continue following that here also. There are women who ask for that. And do you want your baby placed on your abdomen, that is immediate skin to skin, whether they want to initiate the breastfeeding immediately? So these are all certain things which we can discuss with the patient prior to getting into labor, so that we'll give them what they need. And again, feeding, so immediate skin to skin and feeding, immediate initiation of feeding is something which most of the women will want. And recently the initiative taken up by the Breastfeeding Network of India, iDecide, I think it is going to launch this iDecide very soon. They are giving this option of leaving the decision to the woman about how she wants to feed the baby. So all these are like we are more towards the human rights. We are not trying to violate the human rights. We want to give a birthing experience very memorable, very understandable, and something which is very comfortable for the women. So this is where the birth plan helps.
Who will we discuss this with, doctor?
So the birth plan, once you are very clear about what you want, I think you have to go and review the birth plan with your husband. Has to know, people around you who are going to support you. They have to know what kind of interest you have. And also you have to discuss it with the labor coach or your doula or your birth partner, and also very importantly, the doctor. So all these people should know like what kind of birthing experience you're expecting. So this is very important, so that those people support you in reaching there.
Okay. But in India, not many people are aware of all this information. So do you really think we need to have such a planning in India? Or do you think we should follow it?
I think, as I told, we know that India is a developing country and the second largest in the population, and we have large group of women coming for birthing every day. So I know women's voices are largely ignored in India, but what the studies say, especially this Yam et al., which was a study which was conducted, they say if you give importance and if there is a well-planned delivery which is happening, birthing which is happening, this is found to be more safer and more satisfying to the women. So if you want to have a very safe and satisfying birthing experience, I think this kind of birth should be practiced in India as well. And they've also found the easiest births are those involving parents who took time in advance to talk and listen to their care provider in order to develop a birth plan. So those births and those parents who took time in discussing and giving all the information to the doctors, and also having the consent of doctors to go through certain birth experiences, are found to be very safe and comfortable and very memorable experience for them. So I think it is not something which is difficult to follow. Maybe not in a government hospital. At least we would like this to be followed in the private situation in institutions.
Okay. Nice, doctor. I think most of the questions that I wanted to ask has been covered.
Okay, I think we provide certain choices in our hospital. I would like to play a small trailer video about what we do in our hospital. It's not a full video, it's just a small trailer video. I'm Dr. Kavitha Gautham, obstetrician and gynecologist. Started educating the couple about the birth choices, and then we wanted them to be more aware about what they, even if they're opting for a choice like natural birthing or water birthing, whatever it is, we wanted them to read more about it, understand the entire process. And directing the course and manner of birthing so that the result
கன்சீவ்ங்கிற அந்த ஒரு வார்த்தையை கேள்விப்பட்ட உடனே நான் எல்லா கடவுளுக்குமே நான் கும்பிட்டேன். ஆஹா, ரொம்ப தேங்க்ஸ். நீ
just like what is natural delivery, what is normal delivery, and what is C-section.
அந்த ஒரு ஃபீல் வந்து ரியலி லைக் ஹெவன் தான். ஒரு அவ்வளோ அருமையான ஒரு ஃபீல். கண்டிப்பாக வேற எந்த ஒரு எந்த ஒரு விஷயத்துலையும் நம்மளால வந்து அவ்வளோ ஹாப்பினஸ் வந்து நமக்கு கிடைக்காது. கையில் ஒரு நம்மளோட குழந்தை வர ஒரு ஃபீல். Birthing has different forms and variations. You can choose the way you want. Freedom of birthing helps you choose. That's it.
Nice video,
Thank you
doctor.
so much, Sai, for asking so many good questions. And I enjoyed answering, especially the C-section thing, which I've been waiting to answer so many people. So thank you so much. And I wish all the women a happy Women's Day. And I hope this year we start with this promotion of birth choices and respecting women's wishes during her birthing and delivery. And I wish this concept is being accepted widely in India by many other gynecologists also.
Thank you so much, ma'am. It was extremely insightful, and our users have gone through your session and they have a lot of queries to ask you regarding different birth techniques and general queries related to normal delivery. So, the first common question here is, would you want to share some tips for natural delivery?
This is a question, is it? Okay. So tips for normal natural delivery is something which I would like every woman to keep a check on what diet they are having. I don't want them to overeat and then gain a lot of weight and get into any other medical complications. So first thing is concentrate on your diet, keep a check on your weight gain, and be active right from the beginning of your pregnancy. Being active is something which you keep doing your regular household activities like brooming the floor, climbing stairs, going for a walk at least 30 minutes a day, using the floor to sit most of the time. These are something which is our regular activities. Now, I won't even say this is an exercise. So keep doing all this. And people, women who are very active and who keep doing their household activities and give a little bit of extra care during the pregnancy and keep a check in their weight, I think they can go through a comfortable normal delivery or natural delivery.
Thank you, ma'am. Moving on to the next question here. Would you like to talk a little bit on VBAC? A lot of queries on, previously I had cesarean because of unfortunate reasons. Maybe the baby's height was too much, or the cervix was not dilated, and all that. So, what can they do so that it does not happen again?
The first thing is, I think they have to plan the second pregnancy a little later. A comfortable period for a VBAC would be a 2 years gap. Anything less than 2 years, I don't think it is very comfortable for the doctor to proceed with the delivery. So anything more than a 2 year gap is something which is required. Secondly, be active, keep doing exercises, keep your weight on a check always, and choose a hospital or doctor who promotes a VBAC, who's confident in doing a VBAC. And that is also very important because not every obstetrician is comfortable in doing a VBAC. It is not because it is dangerous. There is 1% chance that the previous car can give up and then you can land up in an emergency, but that is just 1% chance. 99% of the time it doesn't happen. So if you take the 99% of the time, I think uh, most of us can go through a comfortable VBAC if it is being motivated right from the beginning. And so far we've never had any difficulties in conducting a VBAC, and our VBAC success is very high. Almost 80% of the women who come for a VBAC go through a successful normal delivery after that.
Yes, understood, ma'am. So now we have a few queries about cervix dilation. Like, what should the ideal dilation should be in the second trimester or towards the end of second trimester and in the third trimester to see that they have a normal delivery. So, is there anything they can do from their end to increase the dilation?
No, I don't think there is anything which the women by herself can do anything with the dilation, but probably exercises can help. Doing squats and birth ball exercises, being active even during the labor can help with the descent of the baby's head, eventually leading to the cervical dilatation. The uterus also dilates because when the baby's head comes down. So I think not just lying on the bed, being active even during labor is something which can help them.
Thank you, ma'am. So there are users who have gestational diabetes or hypertension. Like some single artery, single umbilical artery. Would you suggest that they also plan for normal delivery, and what can they do with these complications to go through natural birthing?
Okay, again, it depends on the doctor. And in our setup, I think we allow, if the woman's sugars are under control, she's on medications, she's on strict diet, her sugars are under control, probably we allow them for a normal natural birthing. We don't advise a C-section at all. If the sugars are very uncontrollable, the woman is not able to follow a particular diet and all that, probably maybe she will land up in a C-section. And if the BP is under control, a mild elevation in BP, we do allow a normal delivery. If it is an uncontrolled blood pressure, then only we decide for C-section. And single umbilical artery, I don't think it is a reason for a direct C-section. We do allow a normal delivery.
Thank you, ma'am. When is it the right time to prepare a birth plan? Like before delivery or like before pregnancy? Or like some people may want to plan even earlier or during pregnancy or in the second trimester. And also, when do they get to know if they'll have a normal delivery or C-section? Is there a way they have a query like that? So.
Birth plan, there are few patients who come and I mean, in the first visit itself, they will talk about how their pregnancy and delivery has to happen. There are women who are very clear in what they need. And there are people who slowly get educated certain kind of particular birth plans by when they are like 36 weeks of pregnancy, when they are just entering into their term pregnancy, some a time where most of them will discuss about how their delivery has to be. And mostly these are women who are already highly knowledgeable, who read enough about the labor process and delivery. So then they know the pros and cons, then come and discuss with the doctors about what their wishes.
Thank you, ma'am. How is the fluid level connected to normal delivery? We've had a lot of users who had to go through C-section because the fluid levels drop. So is there anything they can do to maintain it so that they don't land up in that situation? Oh, I think we lost ma'am. We'll just be back to all the users. We'll be back.
Sorry. Hello?
Yes, ma'am. Please go
Sorry,
ahead.
something went wrong. So the question was about the fluid level. My comfortable level, see, normally when the baby enters into term pregnancy, the fluid level drops. That is a normal thing. There's no abnormality related to it. So we've conducted normal deliveries even when the fluid levels are 4 and 3, and we've not seen any major fetal distress or anything going wrong with the baby as such. Probably we are very careful about what medicines we are using to induce the labor, whether we don't use much medicines at all. That could be one of the reason where we don't see babies getting into fetal distress, at heartbeat problems or anything during the delivery time. So fluid level generally drops, and that is okay. And till it is 5 centimeters, I think we are okay to allow her to wait and go through a normal delivery. If it is drastically reducing less than 5, probably we will advise her to get admitted and induce her and deliver rather than taking her directly for C-section. So our experience, we don't do a C-section for such people. And we are very careful about induction. We are very careful about what medicines we are using during labor so that it's more comfortable and safe to the mother and baby.
Sounds great, ma'am. So some of the users are asking how to handle the fear and anxiety of labor pains. And would you also like to touch a little on epidural and how safe it is? Yeah.
Epidural anesthesia is very safe. It is nothing very risky to the mother or baby, because some women have to be in labor for a longer duration. So when they are in labor for longer duration, obviously they're mentally tired and physically tired, dehydrated. So the waiting time, they don't feel like waiting longer and immediately opt for a C-section. So in that case, probably we will use a epidural anesthesia, which is quite safe if it is done by a well-trained anesthetist. They go through a comfortable period where they can relax, enjoy, sleep, And then slowly, when they're about to deliver, we cut down the epidural and then we allow them to deliver normally. We don't use any instruments. We don't. And there's no difficulty when we cut the epidural. That is, disconnect the epidural anesthesia at the time of birthing. So I don't think it is dangerous to the mother. It is quite safe.
Great. Ma'am, also, if you would like to motivate them a little about handling anxiety, labor anxiety.
So labor anxiety, I think there's a lot of fear towards pregnancy, fear towards how I'm going to deliver, whether I'll be able to go through this pain. Fear. Some of our cousins or sisters would have said labor pain is a very, very unbearable pain. So these things will get into our mind, and there's a lot of fear and anxiety towards the pregnancy as well as the birthing process. I don't think you have to have that fear. First, enjoy your pregnancy. Pregnancy is nothing like a disease. It is a very normal physiological thing any woman has to go through in their lifetime. So it is better we enjoy that, make it memorable, and at the same time keep it safe by having a very healthy diet. Pregnancy is not a period where you can binge eating or eat anything you want. So that kind of thing is also there in our mind. So pregnancy, you're pregnant now, you don't have to diet, you can eat whatever you want. This is not something which we have to do. Even during pregnancy, we have to be careful about our diet, we have to be careful about our weight, be active. I think you will go through a comfortable and memorable delivery.
Thank you, ma'am. That will be very helpful for all our users. So the other question that I keep seeing here is, what is the ideal weight gain that you would suggest during their pregnancy so that they can plan accordingly?
Okay, so the ideal weight gain is let's divide it into three types. One is if the woman is very underweight. Yeah, I've seen women at 30 kg, 35 kgs coming with pregnancy. So that is a very underweight woman. For her, we can recommend a increased weight gain that is allowed for her because she's already underweight. She can go up to 10 to 15 kgs of weight gain during her pregnancy. The next group is the normal group, where already the woman is in a right BMI. Her BMI is very normal weight. Probably for her, we can go up to 10 kg weight gain during the entire process of pregnancy. And there is another group already who are overweight. The start of the pregnancy itself, they are like little more than what they have to be. So that group of women need not gain a lot of weight. Even a 5 kg gain during the entire birth process, pregnancy process is enough for them. And there is a group where they are morbidly obese. There are women who come at 100 kgs at the start of pregnancy itself. So those women, I will keep them under very strict diet and very strict check of weight that I don't allow them to gain even more than 3 kg. So it is not that every woman has to gain 10 kg, every woman has to gain 10 or 15 kg. It's not like that. It has to start with what was your weight at the start of your pregnancy.
Thank you, ma'am. So I see there is another very important question here. Would you suggest any exercises for normal delivery, and when can they start those exercises?
Yes, definitely. There's a lot of exercises which a woman can follow to get, especially the pelvic exercises. I would suggest two ways. One is doing your own household activities like brooming the floor, sitting on the floor will open up your pelvis, and doing your household activities like climbing stairs at least few times in a day, and at least a 30 minutes of walk a day. These are something which is right from your household work. The second would be particular focused labor exercises that are like focusing your pelvic bones, muscles, and relaxing your perineal muscles. That is lunges. Probably you can do squats, a full squat or half squat, whichever is comfortable for you. Breathing exercises and cat and camel. These are something which are very particular to the pelvic muscles, and also the butterfly stretch. So these are something which will help you go through a easy delivery.
Thank you very much, ma'am. I'll just take one or two queries more. How to deal with low-lying placenta? Do they also have chances of normal delivery, and what should they do since the beginning to plan for normal delivery?
Okay, low-lying placenta is something which is contraindicated for a normal delivery. If the placenta is very close to the opening of the mouth of the uterus, there is a lot of instances that you will start bleeding too much. So this bleeding can be dangerous both to the mother and baby. So hence, if it is a low-lying placenta, probably there is no chance for a normal delivery.
Understood, ma'am. Uh, when should they start the prenatal yoga practices?
Yoga is a very, very comfortable and safe both to the mind and body. I don't think if you're a yoga practitioner who's been doing yoga right even before getting pregnant, I think you can continue your yoga. Probably pregnancy yoga is something which you need not stop at all. You can continue right from the start of your pregnancy till you deliver.
Thank you, ma'am. Last question today: how to prevent meconium aspiration in babies? Like she's faced it in her previous delivery. So, is there anything she can do?
No, meconium aspiration is completely under the control of the doctors. You cannot do anything. Probably the doctors have to identify. I don't know why the baby had passed meconium. So if there is meconium, we still allow for a normal delivery unless and until the heartbeat of the baby is fine and the labor is progressing fine. But if there is any heartbeat fluctuation, probably immediate decision and delivery through C-section is something which we have to do even so that we don't get into a complication of aspiration.
Okay, I am still getting queries. So, would you suggest that IVF patients also plan for normal delivery, natural birthing?
Yes, we also do IVF. Most of my IVF pregnancies, if the problem is because of the husband and the woman is completely normal, then I allow for a normal delivery. And if it's a very young couple, they're just married for few years and they're very young, like they're in their late 20s or early 20s, probably definitely I allow them for a normal delivery. I don't plan for a C-section. And if the woman doesn't have any other complication like diabetes or hypertension or any other problem during pregnancy, again I allow them for a normal delivery. I choose the patient. Most of them we do allow for a normal delivery.
Thank you so much, ma'am. There are a lot of queries, but you've patiently answered many of them. I've tried to club all the queries in small questions so that we address most of them. Now, moving on to Sai Pramodita. Sai, could you share your, childbirth experience before this? Like before this delivery, what were your plans and what had you thought, and how did it work out?
See, actually, for my first delivery, it was a C-section. So my mind was I was really scared to have another baby because I didn't want to go through the same thing again. And then later on, for my second pregnancy, it was quite different because I wanted to have a normal delivery. I've heard about VBAC, but I've never met anybody who had actually experienced it. So when I met Dr. Kavitha, I think I was in my 34th week of pregnancy. So basically, I had only 4 weeks more for my due date. Whatever queries you asked right now, actually, I had gestational diabetes. My water was low. I was really panicking, but then the kind of positivity that the whole team gave me, I think that is what helped me get through this VBAC. To be frank, even we waited for 24 hours for me to dilate completely, but it was only 4 centimeters. Then doctor suggested that I should take the epidural. So it was very comforting actually. I had some time to take rest before the actual delivery pain. So after the epidural, I think in few hours I got my pain and I was dilated completely for 10 centimeters dilation was there, and every step actually the whole team had uh, really supported me. Like they were even reminding me how to breathe, and then they were constantly telling me in what position to keep my legs in, how to push, how to handle the pain, everything. To be frank, today when I think about it, I don't think it was so painful at all, because the team really supported me. So it was really a very great experience, and I really didn't expect to have a normal delivery after the c-section, but they made it possible. Definitely, I think thanks to Dr. Kavitha and the whole team, today I'm able to tell many women about my experience, and even they are, not scared anymore because of the C-section. There were so many women who are not willing to have a second child, but today, after this, when I explain to them, they are ready for the experience. So, I think it's a huge change in life for me.
Yes,
Good
I
to
think
know
like you're a
that.
dancer, you're a gymnast. I think you stopped everything after your previous C-section, and that
Yes,
was the reason you wanted a normal delivery. If you
yes.
remember.
After a long
Congrats.
time now, I've actually started to do my gymnastics, doctor. I did handstand, I did cartwheel. So after 3 months of the delivery, I think I wouldn't have even thought about if it was a C-section. So thanks to
Yes.
you.
And I think most of the queries you've answered. You've been through a GDM, you've been through a low fluid level, you were a previous C-section. I think you've answered, I mean, you're a live example for many.
Yes, and the beauty is, doctor didn't see it as a back, what to say, a negative thing. She actually said what to do to, get through that. Even when the water level was low, she suggested the supplement for that. Even for the diabetes, she suggested the diet. So nothing was a problem to go through the normal delivery. So definitely, I think that is what is required for everybody, every doctor to handle the patient. Thank you, doctor.
Thank you.
Agreed. I think the key to, I think, natural birth is, finding the right team and taking support when needed. So thank you so much, Dr. Kavitha. Our users are so happy. They've been constantly messaging on the chat that it was extremely informative. Like many of them might as well go and plan their birth and, make a birth plan tonight. So it has been extremely wonderful to have you here. So I just want to quickly share your certificates here. So yeah, this is for Dr. Kavitha. We are very, very happy and excited that you were here. And we can't thank you enough for doing this session with us and making our users aware of different choices they have. And for Sai Pramodita, you've been such a great host. Patiently asked her the queries most of our users would have wanted to ask. And you have shared your experience. So it has been a great evening for us and a wonderful start, second day of the Women's Day week. So thank you so much. And to all the users, we will see you tomorrow at 6:30 p.m. On a different topic to answer your queries. And to Dr. Kavitha and Sai Pramodita, thank you again. And we will keep in touch with you, and probably our users would like to connect more. So you can check them on their social media handles and connect with them. Thank you and have a great evening.
Thank you.
Bye bye.
Thank you.
Thank you, doctor.